So I'll start over to our next session. We're running a little bit behind, but we have quite a good period of time for questions after our next two speakers. Our next speakers in panel 2 are present today because they're members of the Wildlife Health Specialist Group. Catherine Machalaba is the Principal Scientist for Health and Policy at EcoHealth Alliance, and Dr. Stuart Patterson is with the Royal Veterinary College, University of London. And we're really grateful to them to bringing together their ideas and sharing their expertise with this group. And so when we go to questions and answers after their presentations and verbal updates, we'll be able to go to all of our panelists this evening. So our 3 grantees, as well as Catherine and Stuart. So please keep your questions coming. The team behind the scenes are providing me with a collated summary of some of those questions so I can present those to the panels later. So I'll pass over to Catherine, and thank you, Catherine. Over to you for our next presentation.
Thank you, Dr. Grillo, and thank you for the opportunity to be here. This is such an important topic, and it's very timely, both for public health outcomes, for domestic animal health outcomes, and of course for conservation and biodiversity. And I want to talk just very briefly about how reducing wildlife disease risks supports One Health approaches. And I think for us, this is really the One Health opportunity that we can show sort of this additional benefit of conservation measures. We can work in synergy, we can work really across disciplines, as we heard in the prior panel about the importance of collaboration. So if we just go to the next slide, I just want to briefly highlight a new definition that was endorsed by the Food and Agriculture Organization of the United Nations, the World Organization for Animal Health, the UN Environment Program, and the World Health Organization. This was developed late last year, and I think it's very inclusive. And just to very briefly read it, One Health is an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. And it recognizes the health of humans, domestic and wild animals, plants, and the wider environment, including ecosystems, are closely linked and interdependent. And it mobilizes multiple sectors, disciplines, and communities at varying levels of society to work together to foster well-being and tackle threats to health and ecosystems while addressing the collective need for clean water, energy and air, safe and nutritious food, taking action on climate change, and contributing to sustainable development. So we see it's not only about human health outcomes, it's really, taking into account the needs of multiple species, of different sustainable development objectives. I think this really creates an entry point for the work that this community of IUCN and its partners are already doing, and this value addition to multiple objectives through improved wildlife health management. And if we go to the next slide, I know Dr. Grillo briefly showed this. I just want to say, again, these outcomes that we're thinking about with healthy ecosystems, with healthy animals, healthy humans, there's a lot that goes into it. Of course, as we know, there are many different factors, scientific factors, human behavior factors that influence, for example, human wildlife conflict and management and the potential impacts on wildlife health. We really need to be building in these mechanisms for collaboration, communication, coordination, and capacity strengthening so that we are able to work in this One Health strategy, this really integrated approach. And if we go to the next slide, we see that we have this great opportunity for early warning and early detection, which can inform prevention, really upstream prevention. So if we think about an epidemic curve, whether it's in human populations or wild animal populations, we see that there's this potential to really have a lot of information, intelligence upstream, and work to implement risk reduction measures, or certainly to detect and diagnose very early on and prevent that spike in cases and the detrimental impacts. So I think, we often see this in the context of human health and zoonotic diseases spilling over to humans and livestock, but we also have to be thinking about the spillover to wild animals and the potential consequences. So, thinking about how do we move upstream, how do we get information early on? We heard the great examples about ranger detection and the contributions of the conservation community to have that information early on to be able to share information with public health authorities, with domestic animal, livestock health authorities, and to really work together to manage disease outbreaks and also threats early on when we talk about these drivers of disease emergence. If we go to just the last slide here, I want to highlight what I see as part of the solution. So I'm really pleased to report that IUCN is collaborating with EcoHealth Alliance and other partners to provide wildlife and health guidance for effective, protected and conserved areas. And this is really in the context of the post-2020 biodiversity framework. And this is an activity of the Protected Area Solutions for Biodiversity and Climate Change project that's generously supported by the German Federal Ministry for the Environment, Nature Conservation, Nuclear Safety, and Consumer Protection, or BMUV. And I think, this is something that when we're looking for tangible guidance, and from the prior presentations, we saw that there are these really great strategies for specific diseases, for rangers, for protected areas that we can implement really today, and they are actually being implemented already. So I think looking at what we can do, and here specifically, we're developing guidance for prevention, detection, response, and recovery from disease risks in protected and conserved areas. You can see on the screen just a few topics that we're looking at. So these are things like disease risk assessment, site use planning and buffer zones, surveillance measures, risk communication that incorporates biodiversity when we're talking about disease risk, also thinking about ways to do that with biodiversity in mind. And then of course, One Health coordination. And I would just note that with many partners, including our colleagues at the World Organization for Animal Health, there are excellent resources out there. It's really that pairing of those in the conservation community with the veterinary services to make sure that we have the guidance and know where to look, to know who to contact when there is a disease event. So that One Health coordination is really crucial. So I hope we'll have an opportunity to talk more in the discussion, but just to thank you for the opportunity and to really encourage you to take on the One Health approach and really make those linkages with other sectors, because I think this is something that will show both the value of conservation to other sectors and also improve our conservation outcomes when we're looking at management of wildlife diseases. Thank you.
Thank you so much, Catherine, for those wise words of wisdom, and fantastic to hear about those disease risk reduction guidelines. Certainly will be extremely valuable for those who are receiving IUCN SOS grants, because I think it will certainly be very applicable to them working in protected areas. Thank you. So we'll now next go to Dr. Stuart Patterson. So Stuart's going to give us a little bit of an overview of some of the challenges and barriers that we might be facing in the wildlife health space in relation to disease detection and management. So over to you, Stuart.
Thanks, Tiggy. Thanks for the introduction, and obviously thank you very much for inviting me to be part of this. It's a really interesting webinar, and I'm kind of, I guess, the poor relation in following on from some of those earlier presentations, in that I haven't got a beautiful presentation to show to you, but what I want to do actually is just to start off some discussion and get some ideas going and prompt that discussion, I guess. Hopefully those presentations that we've already had, and we've had some lovely ideas in there, have inspired folks that maybe weren't thinking so much about health previously. And we've definitely pushed across that message of why we should be looking at health, and I think we've really enforced that. What I want to do now is sort of set up some of those questions about how and that practicality. And the organisers for this webinar chatted a couple of weeks ago. We were talking about what we wanted out of this and ways to move forward, not just being able to promote the importance of wildlife health, but really to empower people to become involved and to think about how that might be moved forward and how we might get more projects involved in that. So if I or any of the other panel members wanted to set up a health or a disease surveillance program somewhere, not only would that be incredibly expensive in terms of finance, and it would also take an incredible amount of time. And one facet of that time component is really the local knowledge and understanding what needs to be done in a certain area and what the motivations for doing that somewhere are and how we would go about that. So really, in terms of missed opportunities, which is what I'm trying to promote here, this is the ideal meeting. I was reading some of the comments in the chat as everybody was coming in, and everybody was saying hello to everybody, and it really was reading as a who's who of wildlife projects from around the world. And so it's really inspiring to see how many people are here. Now, some of those projects will already be involved in disease health monitoring, and I think we saw earlier Claudia was mentioning with the Ethiopian wolf having 3 decades of health monitoring with those guys. But many of the projects that we see, and many of the projects that aren't represented here today, will be focused on very different aspects, and that's kind of where we're interested in thinking, well, how can we piggyback off the back of those are our missed opportunities. How can we integrate health research into those projects? So there's all sorts of motivations for projects that people are involved in. So some sites are looking at behavioral studies, some will be primarily based on conservation. We see endocrinology studies, all sorts of things going on. How can we get involved? Well, if that's such a good idea, why is it not already being done? If that's so obvious, there must be barriers to this, and clearly there are. And if we understand what those barriers are, then we can work to overcome them and get folks working together. Now, the barriers that we see might very well not be the same barriers that you're facing in the field. So that's the sort of discussion that we want to promote in this upcoming session. We've already had laboratory facilities mentioned in the chat. There's other issues around permits, and then just throwing ideas out there. What's going on? Is there a lack of interest in disease monitoring? Is it a case of not knowing what to monitor? Do we have lack of access to expertise? Are there concerns about reputational loss? So the questions that I'd kind of like to pose to you now in this next session, and obviously we can bring in other ideas, but do you monitor health? And if you do, I think it's really interesting to know what were the motivations for starting to monitor that health, and how did you decide what to monitor? And if you don't, or if you've been put off from any of that health monitoring, what are the barriers? What is stopping you, and what could we be doing to try and overcome those barriers? So that's my little pitch, and back to you, Tiggy.
Thank you so much, Stuart. Great questions to pose to our participants on the line, those dialing in. There's certainly, as you said, there's certainly the who's who. Many people out there working on some really important projects, both conservation projects and wildlife health projects, and how can we connect you? So that's certainly a really good question. I might go to Catherine to see if she has any answers to Stuart's questions that he's posed in the first instance. So do you know of any barriers or challenges? Stuart sort of highlighted the need to understand those barriers, and certainly Matthew and others spoke about that earlier on in the piece in relation to getting an understanding of different people's perspectives to try and marry the communication around the risks or what needs to happen, but that also happens in terms of collaboration. So Catherine, do you have any advice there for the audience?
Yeah, thank you. I think there are a few sort of systematic challenges that we really have seen in many countries, and you know, I think the first is, I'll just mention it because it came up earlier in the context of the Saiga antelope investigation, the challenge with the CITES permitting. So, you know, there is such strong need for CITES, of course, but there can be this inadvertent delay of moving samples where they need to go when you have really emergency situations. And I think this is, you know, of course, a challenge of not having the laboratory facilities that are able to comprehensively do these disease investigations. You know, it's not always just limited to infectious diseases. We also need really to be looking at, as we heard from colleagues, about chemical screening, you know, toxin screening. So there's a lot when there is a disease investigation that you potentially need to look at, and many countries do not have the on the ground laboratories able to do that. And of course, there are many diseases that countries are tackling that are priorities. And we often see that wildlife are not the priority. And I think that is something that has to be addressed in a One Health lens, and the importance of these investigations and the urgency often, there's I think not a clear understanding about that, sometimes even from the conservation community. So within our community, we have to be working to make sure that there is access to all of the components needed for efficient diagnosis, for effective control. And I think, again, it comes down to building up systems, making sure capacity is in place, making sure that communication is happening across authorities, and that everyone really understands why the steps that need to happen, are so crucial, and that if one of those steps does not happen, it can really delay the determination of an event. I also just want to mention, it's not just what we do in an emergency, it's what we do ahead of time, and building up capacity, making sure the systems are in place and working well, testing them. That's really crucial to do, before the emergency. So I think we have an opportunity to always be optimizing, but making sure that we're really treating wildlife health and wildlife disease management at the same level of human health, livestock health, so we have that equity across sectors. Thanks.
That's great. Thanks, Catherine. I'm wondering if any of our grantees have any insights into some of the questions that Stuart posed to us. I was wondering if Stefan or Matthew or Chris would like to answer any of those, sort of developing what are the barriers that you find, and how do you explore and understand those to try and overcome them. I haven't seen anyone's hand up, so might not have any inputs. Chris, you've come off mute.
I don't have a lot to say on this, but one of the barriers we have is field workers actually who are on the ground actually notifying authorities of problems in terms of disease, dead animals, and enabling us to get samples. So I think it's very important, and we are trying to embark on this, is to train the field workers, as been mentioned before, in fact, on how to identify roughly whether you're facing a disease problem, or record mortalities at least, and then get that information to people who can deal with it and go and collect samples. So that very basic training on disease issues, not at a highly scientific level, I believe is of great importance. And without that, you don't really have those eyes on the ground that you need for detection.
Thanks, Chris. I was wondering, Stuart, would you be happy to put your questions? You had a series of questions there. Maybe pop them in the chat so everyone can have a look at them and answer them as part of their participation. I think there were 3 key questions there. We do have some other questions that have come through in advance of this evening's presentation. So while Stuart pops his questions in the chat, and for those of you who would love to answer, would love to hear from you in the chat about what your health monitoring you do in the populations that you're involved with in the field, and what do you find as some of the barriers or challenges that you're finding. And certainly people are providing some of those in the chat that we've already heard about, such as challenges in relation to diagnostic tests in country and having to send samples overseas. So that almost presents 2 barriers in itself. So one of the sort of broader questions that came up in advance of today's webinar, which I will be directing first to Catherine, but I'll certainly see if our panel of grantees or Stuart would like to answer these as well. With the global emergence of infectious diseases from wildlife and limited resources, where do you recommend we focus our efforts for species conservation and disease control? This is a really interesting question. I think it sort of reflects on some of the things that have already been raised in today's presentations. When we have limited resources or limited connections and limited funds, how do we direct where we're going to go and focus on what's truly the priority when we have those constraints? So I'll go to Catherine. Thank you.
Thank you for the question. Yeah, I think when we look at interfaces, so where those opportunities for contact, how contact is changing between wildlife and humans, or wildlife and domestic animals. It presents these opportunities that are quite logical to reduce risk. And I think that this is something that, is not just from wildlife to humans, but also from humans to wildlife, from livestock to wildlife, or other domestic animals to wildlife. So I think at these interfaces, we can really reduce risk in a comprehensive way, and it can be beneficial to wildlife, it can be beneficial to people. I'll just give the example of the introduction of the fungus that causes white nose syndrome, and this has been very detrimental to bat populations in North America. It was likely introduced via recreational caving, so people going into caves, likely introducing this fungus via their boots, so contaminated gear. But all around the world, we have people going into caves every day, and it's an important source of recreational revenue. I mean, I think there's always these trade-offs, but we need to be very informed about what the risks are. We need to be thinking about how people are changing their interactions with wildlife and what that means for disease transmission. And then I think it can actually be very logical about these strategies to reduce risk, and hopefully very beneficial to wildlife as well, in terms of preventing transmission from humans and domestic animals to wildlife. But thanks for the great question.
Yeah, really, really good question and great answer. Thanks, Catherine. I was wondering if Stuart, did you have any comments on that in relation to focusing efforts, species conservation?
I think a lot of that will depend on local needs, won't it? And picking up what's going on locally, but having a well-developed understanding of that system. I think that there are some big players that we see that are internationally important, but a lot of those are going to be very much on the local level. And I think how diseases impact upon a particular species or on a population of a particular species is something that we probably don't have the best understanding of yet. We talk about a lot of zoonotic diseases and how they can transmit to people, and we're worried about those. And then we talk about diseases that we're concerned about transmitting, infecting our livestock. But there aren't that many diseases that have been really well studied at having a population impact. So that's something that would be really interesting to know more about in the future.
That's a good point, Stuart. And certainly one of those things I think that, was already mentioned by our panelists is, doing disease investigations as part of conservation programs where it's possible and where there's an identified need within the local context can help facilitate and perhaps build those relationships that can be very fundamental when responding to something more urgent in relation to wildlife health. There was also a very apt comment as well that links to your notes, Stuart, in the chat about involving the local community around and finding out what their perspectives are when wanting to explore not only monitoring but also implementing practices that might be needed to mitigate or manage diseases that are known to occur. And I think that's a really useful comment in the chat from our audience. And there's some really good chat coming in. So really grateful for everybody sharing their stories. So certainly I realize that we don't have time to necessarily read all of them, but definitely have a read of those. I can see Matthew's turned on his camera. So I was wondering if you had a comment.
Yeah, I did, again, to underscore that point at the end of my presentation about preventing the pandemic's source, because it's like opening a Pandora's box, isn't it? Once it's out there, how on earth do you contain a disease like African swine fever that now spread in something like 50 countries plus, and then becomes endemic in within a region like in Europe, for example? I mean, it's just so difficult. It's so expensive. There's so much luck involved as well. And so, what do we therefore need to do? I mean, there's a couple of key things and some good scientific studies that have been written on this. I'll share the links later as well. But where you get these spillover events, it's where you start to then disturb the natural ecosystem. So the forest ecosystems in particular. I mean, I think Nipah virus in bats in Bangladesh and other countries where there's been outbreaks, and when you're disrupting the forest, you're bringing these animals, particularly birds and mammals, into closer contact with people and with livestock, and so you're putting them under very stressed conditions as well. And so you're looking at the health of the livestock, how you just have healthy livestock, vaccinate them, really boost their immune systems to, give them at least a fighting chance to have some resilience here. but thinking about the poor nutrition in perhaps some of these rural communities as well, and the human health aspect. And again, you know, making sure that they can be as sort of as fit as possible, and thinking about healthy immune systems there also. And so, you know, that's going to involve protecting the forest. It's going to involve thinking about co-management strategies around protected areas, for example. It's going to involve good agricultural practices where you're improving without needing to expand or encroach into forest areas, but increasing yields in farmland in that way. Again, good livestock husbandry practices as well. So that could be the vaccination. I mean, a lot of awareness and outreach built around that as well. We've got to look at the wildlife markets, because, you know, this is where perhaps COVID-20 is going to come from. And so, you know, we're sitting here now, you know, hopefully coming through COVID-19, but, you know, these pandemics and zoonotic EIDs, they're increasing. So they've been increasing over the decades in frequency. And so we do wonder how many bullets we've dodged by ones that have emerged and then died out. But obviously, COVID-19, we haven't. And worse could be to come. And so we really need to think about what we are doing with these commercial markets, not improving just the hygiene, but think about how do we shut them down without impacting rural community health aspects as well. And so some of the work we've done, we'll be looking at the price of wild meat versus domestic meat. The wild meat is actually more expensive. And so a wild Sulawesi warty pig is more expensive per kilo than a domestic pig. And so it perhaps suggests that this isn't such a poverty issue, but it's more about wealth and consumer preference. And so, you know, maybe there's a different way that we can approach that also. You know, when we have these rearings, we've got high density rearings of pigs and other livestock under really poor conditions. I mean, again, that's the breeding ground for disease outbreaks as well. So just improving the meat industry more broadly with some of the practices. And so I think within that, there's a lot to do, but really just comes back to thinking about that interconnectivity between healthy ecosystems, healthy people, healthy livestock. I mean, really, you know, we are facing these three interrelated crises that I was talking about. And that's really where a lot of the attention's got to go. How do you do that? Well, thinking about some big global funds that can prevent rather than respond to this is certainly going to be a cost-effective intervention. And there's been interest in that, and some developments. GEF and Round 8 has certainly put a lot more attention onto this, and that's very welcome. And I think that's is going to make a big difference. We just need to think even larger than that as well.
And I think it's really, really fantastic points, Matthew. And certainly I did some research before presenting today and hosting this event, and looked through many of the IUCN SOS grantee projects that are on the website. And many of those are actually focused on those things that you're talking about, Matthew, is prevention, is actually thinking about how do we protect our habitats, how do we reduce poaching. All of those things can actually help to prevent the next pandemic. So in fact, I think all the SOS grantees are probably doing their bit in wildlife health detection and disease management, which is fantastic. So we do have some more questions, so I'll keep going back to my board. So the next question is, we know that there are hotspots globally in terms of emerging infectious diseases. And the PREDICT project focused on building laboratory capacity and surveillance in certain hotspot countries and regions. The question posed is, should we continue to expand and sustain these projects? So I was wondering if someone would like to answer that. I'll maybe go to Catherine first, mainly because I gave her this question in advance, telling you our secrets, and then I'll go to others on the panel.
Great, thank you for the question. I think the PREDICT project and other similar projects are really important for many reasons. And one is, of course, the laboratory strengthening, the surveillance strengthening, building the capacity and sharing information across sectors. You know, some of that really then led to the formation of these One Health coordination platforms. So initiatives that are helping to bring different sectors together, to show how information can be utilized with the collaboration of multiple sectors, how interpreting information, including about novel internal microbes that may or may not be pathogenic. I mean, I think these are all really important, where you do need a One Health approach to put it into context. I just want to mention that for the PREDICT project, you know, it's some of these collateral benefits that we don't always think about, but are really important for conservation, were really generated. So just the approach itself was focused on being minimally invasive, so not taking voucher specimens, for example, but really getting you know, samples in a way that is very safe for humans and for animals. So that does not stress out the animals, allows us to get information in new ways, to also then screen samples for species identification, for example. So I think all of these biodiversity benefits that can come from disease surveillance, and similarly, as we're doing biodiversity monitoring, building in disease detection, sort of these ways to pair up conservation and disease monitoring efforts. And then also another key area of the PREDICT project was community engagement and risk communication, and doing that risk communication in ways that also create awareness about biodiversity, about why it's important. Why if you have, for example, bats in your community, say you have a mango tree with bats, you know, you don't want to cut down that mango tree. You don't want to target those bats for killing. You want to live safely with other species. And I think that, you know, some colleagues mentioned we have to do this in context specific ways. The needs of communities, the situations really vary. I think we need that on the ground, working together with communities to find those solutions and have those community owned, community led solutions. But I think we do need more projects like that bring together information in a One Health approach, but really through the leadership of conservation. So I just want to commend IUCN for helping to do that and really build up the conservation contribution to One Health efforts. Thanks.
That's great. Thanks you, Catherine. Did anybody have any other thoughts or comments from the panel in relation? I guess it sort of it relates not only to PREDICT projects that are focused on laboratory building, but I guess others. You know, do we continue to expand those? I was wondering if Stefan might have some insights into that, given your experiences in Kazakhstan.
Yeah, sure. Sorry. So it is very important, but what we learned really to get this whole health monitoring together, like domestic livestock and wildlife, and to integrate it into one concept. That what was crucial in our case, and that what's has been done after the die-off we saw, but always, as we talked about barriers before, it's always a question of funding. And wildlife health is usually not regarded as important as health of humans and livestock. So to promote this idea of One Health and to see it all as one complex is, I think, key to improve the situation. And we are still struggling with this actually in Kazakhstan. So but it's really important and should be pushed more to convince politicians and to provide funding, which is actually really needed, and not rely on NGO funding or international funding.
Yeah, thanks, Stefan. And certainly plays to some comments previously from our panel around systems and frameworks, and trying to build those up to be inclusive of all the professionals in the One Health space, including those on the ground doing wildlife conservation work, as well as wildlife veterinarians, ensuring that One Health isn't really two health. Sometimes it occurs. Stuart, did you have any comments in relation to that question to the panel?
I was just thinking. Sorry, yeah.
No, go for it.
I think that the point came up just then. Some of it's more about prioritization of resources, isn't it? Because some of the answer, the straightforward answer to that is, do we want that information? Yeah, of course we do. Realistically, we want to know everything about everything, and it's choosing when you want to put the prioritize your resource towards that. I think some of the aspects from programs like that and surveillance programs, though, some of I think the expectation is that they're about predicting pandemics and where's this going to happen and control, but some of the value comes afterwards as well, and I don't think that's always seen. So I think if we looked at Stefan's example with the Saiga, I bet you'd have loved to know what the Pasteurella situation in those animals was before the outbreak, but that wasn't being collected at the time, or at least I don't think it was. So being able to have that sort of baseline of data, the more we've got from there, then when things do happen, when outbreaks do happen, we can actually have much more of a look at the effect that some of these pathogens have, because finding the pathogen after an outbreak, we don't know what's changed. Is there an increase in the prevalence of that pathogen? Has the pathogen changed in some way? But having that baseline allows you to monitor the effect much more easily.
No, that's so true, Stuart. And also understanding what's changed and why it's changed can help you understand, what management options you might have in your pocket in future. And I think Stefan referred to that, and maybe I'll go to Stefan for some comment here, but you mentioned sort of the monitoring of livestock health and understanding the livestock health in the area and the potential for those to be impacting the wildlife in areas, and wondering what you've done in that space, or what your collaborators have done in that space in relation to potentially preparedness into the future. You talked about your guidelines as well.
Yes, exactly. So we have integrated all this in these standard operating procedures, which I mentioned during my presentation. But again, it's lacking official adoption of these guidelines. And then also this is again related to funding. So we haven't achieved this yet in Kazakhstan. Although, of course, the situation in the Saiga area where the die-off took place has improved. So the vaccination among livestock has improved, and also regarding PPR in the areas where the outbreak was, that has been improved, and that's good. But still, there can be done more, especially on monitoring, even though it doesn't bring like new and important results every day. But you get, as Stuart said, you get this baseline understanding of what's actually happening, and that's really important. And just to mention how we worked around this problem of lacking funding is that we invited just official laboratories in Kazakhstan to come with us to the field whenever we work with the animals, and let them take samples, and they then do the analysis in the lab, and that gives some extra knowledge about what's happening there, even though there are no special monitoring programs available. But that helps at least to get some data.
Yeah, that's great. And does that familiarity, if they're going out to the field with you, does that give them sort of a real tangible understanding of what they're involved with when they take the samples back to the lab? So sort of the
Yeah, of course. Yeah, so they get a lot of information from us. So it's kind of also a training on the job. Yeah, as I said in my presentation, we don't have good wildlife vets in Kazakhstan, but now they are getting better and better because they go to the field and they understand what they're doing, also through working with international experts coming in. So that was really helpful, and that's why also they are still willing to go with us, because they understand that there is a value in doing that.
I was wondering, Chris, if you had any reflections on laboratories and capacity and sustainability. I think those are sort of the key words that are coming through in this discussion in relation to your experiences in Africa. Any wise words?
Yeah, I can say for my own circumstances, we have a small laboratory which we can do a certain amount in, including histopathology, which I think is very important, in fact, in looking at what sort of diseases you might be dealing with, although the microbiological aspects of diagnosis are a bit more problematic. However, I think while we would like to have increased capacity, as important is the ability to shift samples to labs that do have everything quickly. And if you can't do that, you're really facing a major barrier. So yes, strengthening local laboratories important, but equally important is getting samples to the really sophisticated laboratories quickly.
Thank you. That's a really good point, Chris. We do have some more questions, and we've got a little bit of time. So I have one more question I'd like to ask the panel, and I'll maybe direct this to Stuart first. Can one design emerging infectious disease surveillance program for wildlife rescue centres or conservation breeding projects or conservation planning? And I think we've probably touched upon this a little bit, but I guess it comes back to that focus that you were talking about, Stuart, around that understanding diseases and collecting that information up front through a surveillance program.
Yeah. Okay. Yeah, I think that things like rescue centres and the sort of thing that you're talking about there, it's a wasted opportunity if we're not using them. But we have to be aware of the limitations as well, and I think that's comes down to how we're interpreting it. So a lot of the limitations might be around sample size, not knowing the denominator population, what's going on around, but also really the bias in selection with some of those animals. Where have those animals come from? Are they a fair representation of the population? But we know we can't test every animal for every disease. So it's thinking about why we're putting in that surveillance in that position in the first place, and what the questions behind that are. So is the question, do we want to know the prevalence of that infection in an area, or is it that we just need to know whether something is in that area? So I guess the key questions there are the particular pathogens that we want to prioritize. So if we're designing this surveillance system that you're asking about, why are we doing it? Is it because we know we've got a problem with that pathogen in that area? Okay, so we'll focus on that pathogen. Is it because we know that species has a problem with that pathogen? So we might be thinking again, might be about Pasteurella in the Saiga. It might be about distemper in tigers. So we can be consulting with local experts who know what a problem in that area is, but also species experts who know what we might want to look for in that species. And then also groups like, I guess, us, the Wildlife Health Specialist Group, get in touch and say, look, what should we be looking for in this area? So there's that question about which pathogens you would be looking for if you design that system. And then the second aspect, I guess, would be what's your motivation? Do you want to know simply whether it's present or not? Do you want to know which species it's in? Is that important to you? Do you need to know how many animals are infected? So understanding all of those things can be really important. And I think those sorts of centres where they can be, and sort of allowing for limitations where they can be really important, is using sentinel populations and using scanning surveillance. So as a sentinel population, and in both cases, really, I guess what we're looking at is change over time. So if your limitations are the same, then we could say, well, what's changed in this environment is something new coming in. We're watching that particular population of animals, etc., etc. So I think it's very much thinking about those centres as a resource, a really useful group to be watching, and then thinking about, okay, well, we know there's limitations in those samples. How can we get the most use out of them?
Yeah, that's really good insights, Stuart, and really sort of working through the questions that you're going to be thinking about when developing a surveillance program, and the why and what the objectives are really critical. So thank you. Well, I'm wondering if any of our other panelists wanted to add to that response from Stuart.
Yeah, I mean, I'm happy to. So just a couple of examples. So USAID, FAO in Indonesia, working with Ministry of Environment and Forestry, set up Sehat Satli. So it's the wildlife health information system. And so it's a way to report. You can be through SMS, it can be through email, other types of reports as well. As Stuart mentioned, it could be sort of receiving information from wildlife rescue centres, but also from the public in these landscapes where some of these spillovers or outbreaks may be occurring. So that's something that started up now. And so we're seeing, for example, how African swine fever has been being handled through that system. So it's a nice example where the sustainability part, which was a really good question that one of the other IUCN members raised in the chat box, it's being institutionalized within government, and so therefore has a much better chance of being sustained over the long term rather than being part of a short-term NGO project, for example, or something like that. And I guess also in Laos, so the work that OIE is going to be doing, looking at that interface between domestic pigs and wild pigs. I think WCS and others will be part of that as well. But then that also builds in with what the Laotian government's doing with some of the SOPs it's developing. And again, just with the government playing a key role with policies or guidelines, SOPs being developed as well that link into this, that just forms part of that integrated and also comprehensive system as well. And a lot of these systems, they are low cost, so they require large amounts of funds to be operated, and then other partners can then join in when they have new projects that relate to this or wish to be involved informally even as well.
Thank you, Matthew. We're very close to the end of our session, so what I'd like to do is go to each of our panelists or speakers and get a key lesson that they've learned from today that perhaps they didn't know about before. And I might start with Catherine first, and then I'll go to Stuart, and then I'll go to Matthew, Stefan, and Chris. So it gives you a good idea of what order we're going in. So we'll go to Catherine first. What lesson have you learned this evening?
Yeah, thank you so much. I really appreciated the very specific guidelines, for investigation of specific diseases. I think, again, this is an opportunity for training, for capacity strengthening. So as we build up these systems, really making them context specific so that the colleagues on the ground that can use this information today or tomorrow, really have what they need to build that into their workflow. And again, I think that also links to higher level political will, so that's prioritized. But this opportunity again for rangers and other colleagues in the conservation community to be contributing. I just want to give one shout out to the Panorama Solutions community, the species conservation community. Please submit your success stories there. I think the more that we showcase what's working, the more value that will be recognized, and then that sustainability will come along with that. But thank you again so much.
Thank you, Catherine. And Stuart, lessons learned for you.
Thank you. Well, I think one is the amount of interest that there clearly is of just working through the chat and seeing how many questions and how many people are interested in doing things. I get the big reminder seems to be about, and Chris was touching on this quite a bit, was that ability to move samples and that need for working on systems to be better. And I guess again a reminder to try and have these things set up in advance.
Well, it's great reflection, Stuart. And I think I said I'd go to Matthew next, and then Stefan.
Okay. I guess as we're talking, just the amount of information that we don't have, what we don't know, how difficult it is to monitor diseases and just get an accurate picture and then identify the solutions based on this limited information. But as you can see here, there's 200 plus panelists, many working in the field, potential partners who can be helping collect all this type of information. And then just in the chat box, thank you very much to everyone who's been educating me on all the different systems that are out there, which I didn't realize before. And then just one general reflection on, as we were developing this joint communique for African swine fever, I'm not a vet, but just the value of working with vets, so a big shout out for them if I'm going to give a shout out, just how important it is to learn from the experts who really understand these diseases. And again, can be informing someone like myself, who's got other skills in terms of working with protected area partners and things like that, and how we communicate the right messages in a consistent way as well. So a variety of things there, but again, sort of stressing collaborations, I guess, and the importance of that.
Thanks, Matthew. Stefan, any reflections on this evening's discussion?
Yeah, I was actually quite positively surprised, let's say, that all our presentations had more or less the same points mentioned there, that's so the same recommendations coming up, and that makes me feel like not alone with wildlife health issues, which we had also in Kazakhstan quite a lot. So that's very, very positive, and I hope that this will help the whole conservation community more, and hopefully it can also help to kind of make this issue aware to funders and partners who should understand that wildlife health is an integral part of nature conservation. So if you want to do that, then we need to take health issues into account and not ignore them. Also, as Matthew said before, and they with the context of COVID-19, other pandemics might arise, and it's very important to have this all thought together. And that's yeah, it was nice to see that.
Thank you, Stefan. Yeah, I agree. Really good alignment across all the speakers. Chris, did you have any reflections on this evening's presentations and discussion?
Yeah, very briefly. Thank you very much to the organizers and congratulations. I think it's been a great opportunity for me to listen into all this. And then lessons learned. Yeah, I think one thing I can say, I think Stuart's questions kind of crystallize things a bit. You know, do you want to monitor health in the wildlife situation and the interface situation? And if so, what diseases do you want to monitor and why in the different ecosystems around the globe? And secondly, what are the barriers to being able to do this? Well, of course, resources is always a major barrier, but there are other barriers which one can fix fairly easily. Education, perhaps not that easy, but very important. So perhaps I need to think for myself a little bit more about these very basic questions and try and look to the answers. So thanks, Stuart, for bringing that up, and thanks again to everybody. Thank
you, Chris. Fabulous reflections. I'd just like to say thank you to all of our participants on the call today. Really, really great to have you sharing your stories in the chat. Apologies, we weren't able to open up your microphones for a direct conversation. Really challenging with so many on the line, but great to hear that there are so many interested in this session. I'd like to say a huge thank you to our grantees for their presentations today and highlighting some of the stories, barriers, and challenges that they've overcome in many ways. Thank you very much to Catherine and Stuart for bringing their knowledge from the Wildlife Health Specialist Group. We've certainly got a broad range of membership, and hopefully we can move forward and try and connect people better between the different specialist groups within the IUCN and beyond to try and connect those experts more broadly to help try and overcome some of the barriers that were raised today. I'd also like to thank the IUCN SOS organizers. Thank you for raising this as an option for one of the webinars. Fantastic to have a joint webinar between two different IUCN programs. And thank you for hosting the event, and thank you for allowing me the special privilege of being able to moderate the session. It's an absolute pleasure, and I look forward to the next one. Looks like there's lots we can still talk about, so perhaps we can do this on a regular basis. So thank you all again for participating, and we look forward to meeting you sometime in the future and perhaps overcoming a barrier together, because collaboration, communication is what we need to do as one of those solutions. Thank you all for attending.
Just very quickly from my side, I also want to thank you, Tiggy, for leading such a constructive session. I think that we've heard many different case studies. I think some of them with quite dramatic impacts. But at least we've learned that introducing disease management practices is possible. It can be monitored from, and we can also learn from that. So yeah, there's the opportunity to enhance our capacity, by bringing in different actors that they are not normally involved in conservation. We've heard how important it is to link in with other sectors, and that will really help us adapt to emerging threats like this one. So thank you all for joining us today. I hope that you've learned as much as I have. A special thanks to our speakers and our participants for their inputs, our interpreters as well, and the team behind IUCN that has been running the whole webinar in the background. So keep an eye on our social media channels for highlights of today's discussions. And with this, I just leave you now. Thank you again. Have a good day and see you on the next webinar.